And so when we look at the torso, there are a few muscles on the head that I'm going to start with. The muscle around the eye is the orbicularis oculi. That is for closing the eye. There's a muscle on the face right here called the zygomaticus, and that is for smiling. And so if you see if that shortens, it draws the corner of the mouth up. The muscle around the mouth is called the orbicularis oris. And then there's a muscle under the chin, it's called the platysma, and it has to do with facial expressions. On the side is the masseter muscle right here, and that, as it shortens, as you can see, it would act in chewing. On the side of the head is temporalis, and this would help move the hair, and that would probably be the main action that I'm going to say right there. Remember, there's probably more than one action for everything I'm talking about. It's just that I'm not that good, and I can usually figure it out about one action. The frontalis, we may have mentioned it before, but it raises the eyebrows as it shortens like that. As I move to the side, the sternocleidomastoid goes from the sternum and it extends up to the mastoid process. And when that shortens, the head rotates laterally and actually the nose moves away. In the back, it's a little bit difficult to see, but right here is the occipitalis. There you can see a little bit of it painted on here. And that, once again, is for hair movement. You know, why we need to be able to move our hair, I can't tell you the answer to that, but it is what it is. Let's go back to the front of the torso. On the front of the torso is the pectoralis major, and since its origin is along the chest and its insertion is out on the arm, what it does, as you can see, is it actually flexes the arm and actually adducts the arm toward the midline. That's why people, when they exercise this, when they want to do a bench press, to exercise it. Right under here, there's also a pectoralis minor, goes from the coracoid down onto the ribs, and it kind of contracts in that pattern, but we can't see it in this picture. On the torso is the rectus abdominis, and this would help a person bend at the waist, contract the muscles. On the sides, we can see the external oblique. This helps compress the abdominal contents. And then also on the side, you can see a serrated muscle. This is the serratus anterior, and this is for protraction of the scapula. So it attaches to the scapula and pulls it forward. When we go around to the back, there are a couple of muscles on the shoulder. The supraspinatus, which is right here, helps to abduct the arm. The infraspinatus right here is a lateral rotator of the arm. And then there's one on the underside of the scapula called the subscapularis, and it is for medial rotation of the arm. The rhomboids right in the middle are for scapular retraction, so they bring the scapula together in the back like that. On this model, we can also see a large muscle that begins in the lumbars and extends up to the arm. And so when the latissimus dorsi contracts, then it causes the arm to extend backward and adduct, pull closer to the body. So the way that you would exercise this would be like pull-ups on a pull-up bar. As we go down the torso model, there is a gluteus maximus. It is also an extensor of the thigh. And then you can kind of see the cut edge of the gluteus maximus here, and you can see the gluteus medius, which, as you can see, its origin is on the crest of the ilium, and it inserts, looks like, down here on the greater trochanter of the femur. So it's going to be an abductor of the thigh. Matter of fact, that's a site of muscle injection right there, gluteal muscle injection. You can see the sciatic nerve going down the back of the leg in this picture. So that is the torso. That is the torso. You can see some of the leg muscles, but we'll get those on another model here in just a minute.